Okay, guys, we're just a minute or two early. We're just getting all of our tech and everything set up. And anyway, so as we get everything put together, hi, am I saying it right? Is it Elisa or Alyssa? We got actually some kind of good news for you. Anyway, so I just wanted everybody to get ready to start. And hi, Alma. Hi, Tammy. As you're jumping on, it would really help us, give us a shout out of your name and where you're from, and that would be great. It would be really, really nice to be able to know that. We've had people from literally all over the world, and so it's kind of fun to be able to see where they are and know names and stuff like that. So we are just kind of getting ready to start on our third day. I think this is my favorite day. And the reason why I think it's my favorite day is because I love blood tests. And the way that we do it, it's going to be really fun. So, all right, Alma's from California. Chris is from Idaho. Anna from Idaho Falls. Jamie from Preston. Cindy from Utah. Hi, Cindy. And, okay, Alyssa, Tammy, Kim from Texas. Got to represent. I'm going to be in Texas in September at a doctor event, and hope I can survive the humidity there. It's going to be in Dallas. And so Lori from Utah. So again, everyone, just as you're jumping on, love to interact and be able to work with everybody. This time, let's see, here it is right here. I'm going to be, I've recruited some help to be more efficient. So this is going to be fun. And again, we're just getting rolling as you're jumping on. Drop your name and drop your, let's see, drop where you're from. Okay, it's this right here that I need. All right, let's see if I can get this to work. Not quite yet. Well, that didn't work so well. I thought I had something really cool. Never mind. Okay, so we have, as promised, we have some giveaways that we're getting ready for. So everybody warm up, literally warm up your fingers in your typing or your Surrey speech to text or some other things, because I'm in a giveaway mood, so we want to put some stuff together and jump out. Okay. Let's see. Macy said that we should give something away kind of as a funny promotion or thing. Okay, so one of my favorite things, this is going to be really good for anybody that has stomach problems. If you have stomach problems, I want to give you something that is really, really helpful to help break food down. So let's talk about this for a second. Almost every patient, I would make the statement, every patient has stomach problems. The reason why so many people get sick is they don't break things down as efficiently as or effectively as they could, so they have stomach problems. And a lot of times I think we manage stomach problems inefficiently. And so here's what I mean by that. So many times people are running over and getting an acid blocker or an acid stopper to break up acid, and most of the time it's not an acid problem. What it is a lack of digestion problem. So what we're giving away is something called PAN5X, Pancreatic Enzyme Times 5. This is a really strong digestive enzyme. It's fantastic for people that have acid reflux, heartburn, indigestion. It even helps with constipation, because constipation is cell trauma, and cell trauma is it backs everything up. So what I'd like to do is to be able to say, or to help people by giving this. So here is the giveaway question. Macy, are you ready? All right, here we go. The giveaway for the stomach problems is who is Dr. West's favorite author? That is our giveaway. All right. So, Samantha, you smoked everybody. Yes, it's me. This is my book. I'm poking fun at myself, and I'm kind of serious. Matter of fact, I've got 3 other books coming out. very soon. I've written a book with my son called Understanding Blood Tests and What to Do About Them. I'm terribly proud of my son. I've got another one called From Incurable to Incredible. That's the ozone book that we've got coming out, and another one I co-authored with Dr. Cox called Elite Nutrition. And so once I figured out how to get the hang of writing, I'm kind of excited about that. Okay, so Alma, she says, hey, I have GERD. Okay, Alma, one of the things I'd really like to help you with is we need something to speed up digestion, a supplement like this. And a lot of times people just have to remember the supplements that you take for stomach and everything, it has to be basically a 3-level enzyme. It has to have proteases in it that break down protein. You want to break down fats. You want to break down carbohydrates. A lot of the enzymes on the market literally only have one. This has all of them. But when you speed up digestion, the food doesn't have time to sit in there and ferment and rot and decay. It has to get it. And Macy already pointed out, I have a typo. I'm sorry. Let me see. I mean, I might even be able to fix it real quick. But yes, I have a typo. All right. Dang it. I hate it when that happens. All right. Okay. I have to fix it for my own self here. Okay. The other fun thing that we are giving away, let's see. Let's give away another water bottle and pen and lip balm. And okay, I'm trying to make sure that I said everything in the right way. I'm going to say the vitamin that donates electrons to the body and is so important for health is which vitamin? Which, by the way, hi, Cindy Jager, all the way from the Midwest. I'm so happy that you're here. It just makes me happy to see you. That's great. I saw the post that you were having a hard time getting in. They've been out to the office, special to me. Anyway, nice to see you. All right, Macy, you got a winner on that? All right. The other one that we're going to give away, if anybody has blood sugar problems, this is something that's going to be really good for you. Now, I want to talk about blood sugar problems because as we're trying to get people to be healthy, oh my gosh, like there is so many things that are associated with blood sugar. Inability to sleep, cyclic mood disorders, anxiety, depression, really affected by it. 100%. Attention deficit and attention deficit hyperactivity disorder is influenced by blood sugar. And what happens, particularly in our society, is we get too much sugar into the system. It's like throwing gasoline on the fire. Then we have a whole bunch of energy that comes up like this. And then what happens is it dies down. And when people die down, they crash and they can get nauseous, or they can get fatigued or lightheaded, or brain fog starts to kick in. And so what happens is it's so much better to put a piece of coal or a big log on the fire instead of throwing gasoline on the fire. That's where complex carbohydrates and protein comes in. But this is one of the best things to stabilize blood sugar. So one of the things I'm going to give away, it's called Ultra DM Complex. And you don't have to have diabetes to have this, but Ultra DM, it really helps to stabilize blood sugar. It also serves as a really nice multivitamin. It has vitamin E in it. It has berberine, which is going to be really helpful for metabolism. It has some cinnamon in it, some alpha-lipoic acid. So the question that we're going to talk about is this. To get the blood sugar management to the thing that thankfully we were able to vendor to donate it to us, is this. Okay, now I just had a brain squeeze of the question that I was going to ask on blood sugar. Okay, now we're going to have to okay, here it is. What is the recommended amount of daily water intake for a person in the United States or first world order? Okay, a lot of really good answers. Macy, tell me who won. Okay, they were just getting hammered like da da da. Okay, on my chat here, it looks like to me. Let's see. Okay, it looks like to me, Chris, Kris, looks like it's 80 or more ounces. Sarah was good, like a gallon is not wrong. 80, yes, 80 ounces. All right, we've got some more giveaways that we're going to do. I'm going to pick those up just in a little bit. I want to make sure that we get through everything. Yesterday, I went a little bit over. I was worried about not having enough time, running out of time. And then, of course, I was so excited to deliver. Oh, all right. I'm going to give away something else here. Okay, I'm going to give away another T-shirt. Okay, remember the story behind the T-shirt. Actually, I'm going to give 2 giveaways on this for people. Okay, the first giveaway is this. It was not in the workbook. This was our value add yesterday. I really wanted to create value. So for a T-shirt, and the T-shirt says, "I am the hero of my own story." And on the back side, it says, "You're not your diagnosis." For a T-shirt, here's the question. There is something called an interference field, and it blocks energy. What is it? Man, Cindy, you just nailed it. What blocks energy is scars. And hand me another, just grab me a supplement. Here's the next giveaway that we're going to give, which, by the way, I'm going to give away some at the end as well. All right. It is scars block energy. They're interference fields. They have a different electrical component to them than normal skin tissue. And so what happens as the energy pathways are going up and down the body, when they hit that altered chemical resonance frequency of scar tissue, they get blocked. It literally gets dammed. It can't go anywhere. And here's the next question for something called haven't aged. Okay, here it is. So Personal OTC gave us this. Here is it. I was going to say, what can you do to break up scars besides red laser? Okay. Macy, pick a winner. Okay, so here's what you do. You pop the pills, the pearls, the vitamin E pearls, you rub it over the scar. It helps to reset energy. So looks like, I think it's Sylvia. Okay, Macy's saying it's Sylvia that wins on that. Okay. Scars block energy. Now, let's start talking about some other takeaways, and we're going to get into this. We also want to talk about our leaderboard. And remember, here's kind of what we mean by the leaderboard. One of our patients donated a patient care program for the office. We really helped him, and he wanted to give back a little bit. So he said, "Dr. West, I'm going to buy a program for someone." And literally, it's for a year of care, everything that we do inside the office for a year. It's an incredibly generous gift. There is some parameters around the gift, and here's the parameters. Is he wants to remain anonymous. He's just asked if the patient would tell a little bit of their story before they start the treatment. It's really easy. I'll walk you through it. Literally, it's just saying, "This is my name. This is a condition that I have." He doesn't want any publicity or anything like that. But anyway, so here's how you get points for this. And I'm going to show you the current leaderboard right now. I have this awesome technology. Here's the current leaderboard of people that are winning, and here's how you get points. So Alyssa is the front. Jared, Jamie, and Sarah are all now. There's some really cool ways to help points. There's a picture of you with your homework. That's one. There's a share component, a referral. There's also, Macy told me today she wants to help with public comment and video. So if you give us a little video of how you've experienced the challenge or your takeaway, or you do a comment on the post saying, "This is what I've learned in the Hellness to Wellness Challenge," it builds up. It's pretty big, right? Like there's you can jump points a whole bunch. So anyway, and we also have some other really cool giveaways. I think we have giveaways for the top 5 people. Second place, we're going to give away a lab program, which is, we're going to show that in just a minute, which is lab. We're looking at neurotransmitters and heavy metals, and we're looking at toxins and molds and what food allergies and stuff that you're allergic to. We also have some virtual consults. We have a custom work with us every Wednesday night for 6 months program, valued literally at thousands of dollars. We've got some books giveaways. So there's a lot of things that on the leaderboard. We just wrote a couple of them, which, by the way, I don't have fingernail polish, you guys. This is, I tore off my fingernail riding motorcycles. This is what it looks like. I don't want anybody to think that I'm not a fingernail painting person. I just noticed that. Okay. All that said, now we have a couple questions that we wanted to go over, right? Okay, I wanted to make sure we cover that, and then we're going to jump into the binder and blood tests and some other things. And by the way, if you guys want to, all right, Tammy said she rides a motorcycle. Tammy, represent. Like, it's my favorite thing to do outside of the office. Okay, so tonight's program is we're going to be giving away things about every 10 minutes or so. So please stay with us, stay engaged, get ready, warm up your typing fingers, because I've got a lot of other stuff to give away. Also, we want to teach you guys how to look at your blood test and how to look at those in a way that's different than the way that most traditional healthcare providers are taught. And there's something that I can't wait to show you. One is something called alkaline phosphatase. One of them is your white blood cell count. One of them is something called the lymphocyte count. Okay, we're looking for, I forgot to post this yesterday, a medical laser. You can get those on our site. I just need to remind Jose, can you get me a laser page on our online store? I think, if I just remembered them right, I think they're the medical laser. Well, I'll get it up. Okay, no problem. I will get this organized for you. That was one question. The other question is, hey, Dr. West, if I want to start working with you immediately, what should I do? The easiest way to do that, if you guys want to get started right away, is to just send an email to the office. It's info@westcliniconline.com, and there's literally a program that we can help you across the street or across the country. I don't care where you are. I don't care where you live. My mission is to reach, teach, and heal the world. The reason why I wanted to do this program is because the saddest comment in the office is when patients say, I didn't know my options. I wish I would have found you or a doctor like you a long time ago. And by the way, I don't think other healthcare providers have my same sparkling personality and my sense of humor, which I'm joking and serious, but there's doctors that do what I do in many parts of the world and across the country. And if I can't help you, I really want to help you to get to see them. What we want to do is to get you to be better. Okay, the other question that we have is, how can I get off prednisone? And so let's talk about that. The way you get off prednisone is very, very carefully, and you want to make sure that, like, if you stop immediately, it can put your body into a funk or a lull or bottom of the roller coaster. And so the way to do that is to literally go through an assessment and evaluation, start looking at tests, which we're going to review in a minute. And then when we balance the body, like, my goal is to help people to be on the least amount of supplements, the least amount of prescriptions, and need the least amount of treatment as possible. That's my goal. That's my mission. And sometimes there is no option but a prescriptive medicine program. Other times there's a blended approach, and other times people are getting prescriptions that they don't need, in all fairness and honesty. Now, prednisone is a wonderful double-edged sword where it makes people feel so good initially, and then what happens is it can have some unwanted side effects. And so how you help people get off of it, if it's just for inflammation, we're going to talk about this later in the program, but really if you put an essential fatty acid, an omega-3, and a proteolytic enzyme together, the omega-3 helps to insulate the body and helps with pain control, and the proteolytic enzyme helps to chew up inflammation. It literally has the effect of like an over-the-counter ibuprofen, acetaminophen, aspirin, Advil. It just takes some time to kick in. Now, I wish I could say that I came up with that protocol myself. I was taught this by a retired medical doctor that had fantastic results with this. He was in the ER, and he would literally prescribe proteolytic enzymes and fish oil and evening borax oil, primrose oil, GLA inside of the hospital, and tell people, look, if you'll give it a chance, it will be really good for pain control without burning out your kidneys. Okay, Another question is, how can I help my sleep cycles when I'm working night shifts? Super good question. And the way that I would recommend that is to use some horary cycle acupuncture. So each meridian is active for a 2-hour window, and what happens is with shift work and night work and sleep cycles and alternating shifts, that happens is the acupuncture meridians get really, really altered. And one of the ways to really help that is to treat the horary points with that. The other one is to make sure that you have a sleeping sanctuary with blackout curtains. So if you need to sleep during the day, at least your body thinks it's night. Like literally, we want to create a dark sleeping sanctuary. And then there's some natural things that can help with that, also balancing out the body chemistry. But I used to work on an alternating shift cycle when I was an undergrad. I know how that goes. Okay, the last question before we got to jump into the program. They tell me that my thyroid is shriveled up and gone. Is there a way to fix it? And the answer is a big fat maybe. Maybe there's a way to fix it. Maybe there's not. When you have if you've been on prescriptive medication for a long time for thyroid, sometimes it's not possible to get off the medication and go to a natural intervention. Sometimes it is. I've been really surprised some of the response, but we want to look at what we can do to help with the thyroid. There's some special treatments we're going to cover on Friday called protomorphogen therapy, which is a glandular extract that gives the body a blueprint to help with thyroid function. Iodine may be a consideration. I mean, I would have to do a workup with the patient, understand the history and some other things. Also, neural therapy, acupuncture. There's some physiologic therapeutics may be a consideration, such as a specific type of therapeutic ultrasound. There's also something called diathermy that may or may not be a consideration. Those things help to put energy and circulation stuff into the thyroid, but it really depends on the patient workup. And then if there's been a partial thyroidectomy or some surgery, we may not be able to get there. So maybe. All right. Okay, it's going to be giveaway time. I want to talk about, this time I'm going to give away, I keep saying everything's my favorite because you study about them and you learn what all these things do to the body, and then it becomes something like, oh, that's really going to help this. This is called DK Absolute. This is vitamin D3. There is 5,000 units per pill, and then there's also some menaquinine, also known as vitamin K2. So remember why this is important is vitamin D literally helps so many processes of the body. It helps with bones. It helps with hormones. It helps with blood pressure. It helps with your immune system. Really, vitamin D is more, it acts like a hormone, but it was discovered or categorized as a vitamin. And what vitamin D really helps the body do is to get the essential mineral calcium into the right place. So when you put calcium into your body, calcium is so important for your bones. It's important for muscles. It's really important with your immune system. If your immune system is low, so many times on blood tests, you'll see people with subpar or really low calcium levels, and it's not always the fault of the calcium. It's that we can't get calcium into the bones and tissues because we need vitamin K2. So we put calcium into the stomach. Vitamin D picks up calcium out of the stomach and puts it into the bloodstream. Vitamin K2 helps to activate it into the bones. So we have a dual formula. Okay, the question that we have is, can someone tell me, we talked about 7 barriers to healing yesterday, and if someone could give me one of the reasons why your inner circle can accidentally create self-sabotage in your healing process. We went over, there's 5 reasons. And let's see what people talk about. Okay. Yeah, so Jamie, that's a good one. Emotional arm you. Kim said sometimes they want you to be sick because they get also conflicting information, lifestyle. A lot of times, Carrie said, people well-meaning want you to go through the traditional approach. Sometimes it's surgery or chemotherapy or radiation or medical experiments or clinical trial medicine and other things. So, Macy, will you help get that one organized? I think it is. I think it's Jamie Watkins. Jamie, I think I think you were the fastest keyboard. Okay. All right, let's start getting into nitty gritty. If you haven't got a giveaway, don't worry. We're going to have one another 10 minutes or so. Okay, Macy, grab me something, and then will you help me with the question from yesterday? I'm so okay. You guys, here is one of the things that I would really like to share with you is before we get into the blood tests, I'd like to give you some tips and some ideas of the best way to talk to your healthcare provider and really get better service. Now, here is the tip that I'd share with you. The more that the doctor likes you and the more that you like the doctor, the better care that you're going to get. It's not intentional for any healthcare provider really to be like, look, I'm not going to give Macy the care that she needs. Everybody's trying to do that. But when you stand out a little bit, you literally get more care. So here's some ideas of how to do that. This is literally how I want to share with you how to do that. Let me move myself over. Okay. So this is just a white 3-ring binder. This is the recommendations that I have. Now, so in order to get ideal care, you don't always have to have a binder if you'll follow through with some ideas and suggestions with it. Now, I had a patient from about 12 years ago, and if you've been in my office, you've experienced this, that literally said to me, hey, Dr. West, I'm here. I have metastatic terminal cancer. She did not come to my office expecting an unrealistic cure. She said, I know you can't cure me. Why I'm here is I want you to make me as healthy as I can before I die. And I have a fair amount of patients that come in that way with a terminal case or condition, and they're looking for quality life before they move on to the next phase. So I did all my medical workup with her, and I walked around to the other side of the desk. I said, okay, I'm going to go get my team. I'm going to go get organized. Do you have any questions or comments before you start? And she gently put her hand on my white coat, and she said, Dr. West, I am not a patient. I'm a person. I want you to treat me like a person, not a number. I wasn't intentionally trying to feel that way, but it kind of stopped my world for a minute. So now when I ask people, when they come in the office, I always start off with, I want to get to know you. I don't want you to be a patient. I want you to be a person. So what's your favorite color? What do you like to drink? What do you like to eat? What do you like to do for fun? You know, are you in a relationship? Do you have, children or siblings where's your dream vacation? Where's the vacation that you like? What movies do you like? What books do you like to read? And the reason why I do that is I want to turn that person into a patient. Then I turn around and I tell them back, guess what? My favorite color is light blue. I like prime rib. I'd like to drink water. My favorite thing to do is to ride dirt bikes with my 5 sons. I'm married to not a perfect woman. She's just perfect for me for 29 years. I absolutely adore her. And my favorite vacation spot is Alaska. I want to go to New Zealand because they have no snakes. And I don't like snakes. They just absolutely terrify me. My favorite movie is The Princess Bride. And my favorite book is me. I like my favorite book. So the reason why I put that up here is because as you go to create a medical binder, I want you to consider putting something like that in it. So the first thing that we do in a medical binder is, I love this, medical summary. And so this, when you go into a doctor's office, I love it when people do this for me. They come in with a medical summary. I've had some medical needs myself. I had a kidney stone that I have genetics of bad kidney stones, and I had to have a kidney stone procedure. And I walked in, I wanted the binder as well. I walk in, so here is the summary, and you want to stay up here. These are the prescriptions I am, this is the supplements on, this is what's happening. Patient presents and concerned about, this is an example, with Lyme disease and co-infections. Past treatments included oral antibiotics, prescription antibiotics, acupuncture. And then this is the key. I love this when people say, this is exactly what I'm looking for. I'd like alternatives to my medical condition, or I'd like to know if there's considerations to the alternative medicine things that I've tried. And then I put this in here. This is meet me. I'm a person, not a patient. And I just listed, I like all the things I just told you over here. I made a name, like Dewey. I've been married 29 years. I have 5 sons. This is a little bit about me. And then the next component is the blood tests. So I'm going to walk you guys through some blood tests. If you have your blood tests, get it out, and let's go over this. If you don't have your blood tests, No problem. Macy, you mailed it out to everybody? Okay, so this is an example blood test that I would love to share with you, and I'm going to show you some things that will really, really help to understand blood tests and how to look at those in the right way. Or when I say right way, a way that is looking at things from a health standpoint, not necessarily a disease standpoint. So when we start talking about blood tests, remember there's thousands of blood tests. The most common ones are what is in this profile, and usually there's what's called a complete blood cell count and a complete metabolic panel. A lot of times there's a lipid panel. I like to see different types of thyroid tests, which we'll get into, and sometimes there's an iron panel and phosphorus. There's some other things. You know, there's gobs of other tests. There's cancer marker tests. There's peptide tests. There's heavy metal tests. There's urine tests. There's over 3,000. As I was helping my son and we were writing a book, we literally were like, okay, what tests should we go in here? Because there's so many. But these are the most common ones. So looking right up here, if you have your tests, great. If you don't, I hope you have the blank, because this is how we can really help people to understand what's going on with their health. The first thing that we look at is right here. This is called a CBC, or a complete blood cell count. And the white blood cells are your immune system. And then, I don't know why they put them together. I'll show you in a minute. And then this part here is the red blood cell component. And the difference is this. Red blood cells are like trucks on the freeway. They take supplies from town to town. White blood cells are like your state police officers, and they arrest the bad guys and take them to jail. Now, what we want to do with that is to make sure that there's the proper ratio of police officers to cars and trucks on the freeway. Now, one of the things that's kind of tricky but is so important to understand is this thing right here. This is the white blood cells, and then these guys right here are the percentage of the white blood cells. It'd be nice if they were next together, but they aren't. I don't know why they do it like that. And so the neutrophils fight bacteria. This is really, really important to know. The lymphocyte fight viruses. The monocytes are your garbage collectors. They get rid of inflammation. The eosinophils are for allergies and parasites. And the basophils are basically for allergies or inflammation. So here is something that's kind of fun to look at or to remember is I'm going to teach you a little mnemonic that I learned in school, and I hope it sticks. For the white blood cells, we have the fight bacteria, that's the neutrophils, the lymphocytes, the monocytes, the eosinophils, and the basophils. And so it literally is never let my engine blow. And the ratio, this is what they don't test a lot of doctors. 60-30, 8-3-0, never let my engine blow. And so if those ratios are right, it really makes a difference on energy. So if we just extrapolate that over, right here, it's hard to see, he's got an increase. It's too thick here. He's got an increase in the bacterial fighters here. Okay, it's not working. Okay. Because it should be 60. There's the bacteria. Again, this should be 38, 3, and 0. So it's not horribly off. But here's the thing that I'm excited to tell you about. The white blood cell count should be 6 to 8. If we have a good white blood cell count and we have a good ratio, your immune system is working. But here's something that I wanted to point out. A lot of times what happens with people that have chronic fatigue, they struggle with Epstein-Barr and or canker sores, cold sores, hepatitis, parvovirus, cytomegalovirus, and everything. Let me show you what happens. And if this is you have your test in front of you, just check this for me. The number one thing is a lot of times this white blood cell count number will be like 4. So this means your overall immune system is low. And then these numbers here, they are usually the opposite. The bacterial fighters will be like 38. The viral fighters will be like 48 and 8, 3, and 0, or something along those lines. And what happens is that guy right there, the neutrophil count, the lymphocyte count, what happens is that alters, and this is a sign of a classic chronic and viral infection. This is the number one reason why people get fatigued and they can't get their energy back. When I look at blood tests, I see this happen so much. The white blood cell count goes down, which means the immune system isn't keeping up. The viral markers, the lymphocyte count goes up. And what happens is the immune system and the nervous system starts to think that a chronic viral infection is normal. So a white blood cell count, these are like guard dogs. When the bad guy goes into your house, what the guard dog should do is they should literally start barking and chase off the bad guys. When the white blood cell count goes down, the lymphocyte counts up. It's literally like the robber breaks into your house and the dogs said they don't do anything. And so the bad guys or the bad girls, or whoever they are, go over, they steal the family jewels and the electronics and everything of value in the house. That's what chronic viral infections have a tendency to do. And one of the things that really helps people is to upregulate the immune system by literally going and looking at the thymus gland. And it really, really helps. Let's see if I can get it up here. It really helps cell-mediated immunity, which is the immune system that works on the inside of the cells. This is what helps the body to really combat viruses. Okay, here it is, this little guy right there. That's the thymus gland. Okay, so one of the neat things that you can do that helps people with chronic conditions, there's a way to stimulate this by using an advanced German treatment called neural therapy. And you can do these little tiny injections over the area right here. It's called segmental therapy because the nerves that come down the spinal cord and go out through the organs and tissues end up at the skin. The brain, the nerves, and the skin all come from the same developmental layer. If you stimulate the nerves over the organs area, it has a tendency to make the organs work better. They call this segmental or neural therapy. And it's not something that I'm making up or I came up with. I wish I could take credit for it. This is a 100-plus-year-old therapy that we have good organ function. And so we really want to help. If you have chronic Epstein-Barr, if you have cytomegalovirus or parvovirus, we want to look at your blood test, see if your white blood cell count is elevated or if it's normal or if it's low. By the way, if it's elevated, that means that your body is typically responded. And then we want to look at this lymphocyte level. It just gives us a lot of information of how your body is responding to immune system problems here. Now, looking at the next thing down, we're going to go and hit these ones here, is these are the red blood cell counts or the red blood cell indexes right here. So red blood cells are the cars and trucks on the freeway. So the red blood cells, and by the way, just a really neat thing that we want to talk about healthy people for a minute. On the side of your blood tests, over here, there is a range. And this doesn't always the case, but most of the time, you have sick people that are getting blood tests. So you have a sick person down on this side, and you have a sick person down on this side. And usually, if you just about half the range, that's kind of where your ideal levels or numbers are going to be. So when I see this example test, we've got some imbalances here, and we've got too many trucks on the freeway. Our red blood cell count should be about 5 at 6. Our hemoglobin count should be about 13, and our hematocrit should be 43. So you can see all of this right here. It's too high. What happens if you have too many trucks on the freeway is you have traffic jams. Right? Now you think about red blood cells, they carry oxygen and nutrients to the body. And if you have too many problems with traffic jams, you can't get nutrients to the organs and tissues and waste products away. Now, in my experience, most of the time, these numbers are low, not high. I see a lot of anemia in these numbers. This one just happens to be high. In this patient, one consideration would be like you should donate some blood. You should get rid, like you got to take compression off of the freeway system, which is your circulation. Another one that's really important for me to look at is your platelet function, which is right there. That tells me like how you can heal. And ideally, like if you come over here to the range, I really like to have the range right around 300 for platelets. Not always the case. You want to make sure if the platelets get too low, you can risk a bleed out, and that can be like there's numerous things that cause the platelets to be too low or too high. Then we drop down into what's called the metabolic panel. So the first thing that we covered, you guys, is the first thing that we cover is the complete blood cell count: white blood cells, red blood cells, the fighters for bacteria, the fighters for viruses, inflammation, allergies, parasites. Then we look at the red blood cells and their indexes, the hemoglobin, hematocrit, MCH, MCV, MCHC, and platelets. Now we're down into the metabolic panel. And I think there's enormous levels right here, or enormous benefit for levels. Now I'm going to see if I can blow this up a little bit. Maybe if I bring it this way. Okay, this looks a little bit better. All right. So now we're in a different section. Now we're looking at your metabolism. Okay, so everybody knows about glucose. That's your blood sugar. Ideally, it should be about 90 to 100. In this example case, we're heading towards a pre-diabetic pathway, and so that's what glucose means. The next one is looking at BUN, which is your blood urea nitrogen. That's kidney function. Creatinine is kidney function. So blood urea nitrogen, I like to see it around 15. Creatinine should be less than 1, ideally. Now he's just barely, creeping up there. GFR is your estimated glomerular filtration rate. This is your kidney function. Then the ratios, and then we start dropping into the minerals. So the minerals are so important and often get often get neglected or forgotten about in medicine. So sodium, potassium, and chloride, we want to see those all balanced out and healthy. Too much potassium is really bad for you. Too little potassium, really bad for you. Not enough sodium is really bad for you. Too much sodium is really bad for you, which, by the way, I don't know if anybody saw all of the posts. It's kind of maybe it was just my world because I pay attention to this. It's the first time I remember that, at least in media, that we had actually a death of drinking too much water. Did you see that? Okay. So what happened is someone felt really, really thirsty in Texas. They drank literally a gallon, I think it was over a gallon of water in 20 minutes or less than 20 minutes. And it threw off the sodium levels. When you don't have the right sodium, one of the problems is that you swell. It caused her brain to swell, and she passed away. And so with water, too much water, bad. Too much, not enough water is bad. Okay, now one of the things that we want to do is this a giveaway. Oh, a question. Okay. I don't understand that question. All right. So we got a question. I don't understand it. So we're going to have to, she's going to help me do that. All right. Going back and looking at our blood test numbers. So let's just recap. White blood cells, state police officers arrest the bad guys. Red blood cells help to transport oxygen nutrients to the body. If the red blood cells are too low, it's anemia. If it's too high, we have traffic jams or something called, hematochromatosis. One of the biggest reasons for fatigue in the body is low white blood cell count, and usually it'll hover around 4, and then an elevated lymphocyte count, which is a classic sign of a chronic viral infection. And a chronic viral infection makes your nerves degenerate. It makes them behave differently. It causes psychiatric problems, anxiety, depression, cyclic mood disorders. It mimics autoimmune disorders. And I've seen so many autoimmune cases with rheumatoid factors and with multiple sclerosis that see improvement when you get their immune system to work better which we call the cell-mediated immunity. It helps the thymus gland to improve. And I've seen people saying, well, being told now you no longer have autoimmune condition, or it was a misdiagnosed at the beginning. Looking at the blood test here, okay, trying to get it to blow up so that it's better. Okay, now we're going through the metabolic panel. We want to talk about, calcium ideally should be 9.8, protein should be around 7. And what happens, this is another really important thing to look at on your blood tests. Ideally, your blood test should be around, or total protein should be around 7. If it's like this, 7.8, what's happening is he's not utilizing protein very well, so he's stealing it from the body. And what happens is, when I see this, is patients say, my muscles just aren't working that well. They just aren't, because we're pulling the protein out of the muscles. It's high in the bloodstream, but it's not ideal. So, and then we have a protein transporter, albumin, we have a globulin. So we got a little bit of immune system dysfunction with this high albumin marker. And then two things that I really want to focus in on, and I asked Jose to bring this up for me. There's something called alkaline phosphatase, which is a bone liver enzyme, which most of the time providers are looking at it and saying, oh, this is a marker. If it gets really high, what happens is we've got, some metabolic condition, cancer or a multiple myeloma, something bad is happening, something that's dissolving the bones. So too high is bad, almost always they're too low. And alkaline phosphatase is a zinc-dependent enzyme that has direct effect on your zinc levels, but your adrenal function. And when you have low alkaline phosphatase levels, what happens is people are chronically exhausted. I love looking at this as a baseline. This test right here it might be the most important thing that I'm teaching people, is alkaline phosphatase levels. Absolutely, it's affected by your muscle and your liver and your bones. And then it has an impact on your energy levels. Now, right underneath that in your test and in this example is we have our liver enzymes right here. And you want your liver enzymes to be, right around 30. You don't want them too low. If liver enzymes are too low, what happens is you can't make hormones. If your liver enzymes are too high, you have literally just chronic inflammation. Not inflammation, chronic inability. Man, you guys, I'm messing this up here. What we have with high liver enzymes is hepatitis or liver irritation. And the liver is super important for detoxifying the body. Then there's some other tests that we wanted to order for them. We have a TSH, which is the thyroid stimulating hormone that tells us if the pituitary is talking to the thyroid. Uric acid is a gout marker. And one of the other tests that I really like doing is this phosphorus level right here, because phosphorus is your energy molecule of the body. This is a really easy, inexpensive test that you can request. It doesn't come in a metabolic panel. And then for him, we just wanted to check his iron levels. And then here is the rest of the thyroid. So this is all thyroid put together. So what are the takeaways that I'd like you to take away from a test? Here's the takeaways that I'd really like to share with everybody in our Hellness to Wellness Challenge is, number one, your blood is literally a window into the inside of your body. I love seeing blood tests because it's so helpful for people. And literally, if you take a blood test, and if you don't know what things are, literally if you take the range off on the right and you put it in half, that's usually where the median or the middle where we'd like to be. It's not always the case, but most of the time that's the case. Red blood cells or trucks on the freeway, too high. We have traffic jams, too low. What happens is we get anemia. I think the biggest key for seeing with people having Epstein-Barr and chronic infections and stuff like that is to look at their white blood cell count, which should be around 6. And then we want to look at their viral marker, which is the lymphocyte. If the white blood cell count goes down, the viral count goes up. I see this all the time in people that are misdiagnosed or mistreated with fibromyalgia, chronic fatigue syndrome, Epstein-Barr problems. It's that little ratio. And certainly, by the way, I'm not making this stuff up. We just wrote a book about this, understanding your blood tests and what to do about them. Then when we get into the metabolic panel, we want to look look at your sugar levels, your kidney function. We want to look at your trace minerals, and we want to look at your protein levels, and specifically that marker alkaline phosphatase, which most of the time is low in people. It's a really important marker for metabolic disease and bone activity, which, by the way, sometimes it'll elevate if you break a bone and some other things, you get some increased activity. When it's elevated, there's some problems. When it's low, it's usually linked to adrenal exhaustion and low energy for the patient. Okay, so with that being said, I want to give away something. Okay, I want to give away this. This is a wonderful natural pain relief gel. This is from one of our sponsors. They gave us this. It's really good for painful joints. Let me see if I can get it to show up just a little bit better. Okay, there we go. All right. This is, I want to show up just a little bit. It's called Arnica. It's lasting pain relief for muscles, joints, and backs. Okay, and what Macy suggested that I ask people, here is our giveaway question. What is the most frequently overlooked problem for patients? Okay, here it comes. Who's the winner? Okay, I haven't seen it yet. Oh, maybe. Okay. So, Becky, you're the winner. Becky, the most commonly overlooked problem in my experience with patients is that they're dehydrated. They're not getting enough water. Water is like oil for the body. I told you that horrible, tragic story of someone that literally died from too much water intake. That's the only time I've ever seen it. And I've had a couple of people bring it up, but most of the time people are not getting enough water. And I heard a really popular health podcaster, someone asked and said, hey, you know what? I don't like water. So can I get it from energy drinks? Can I get it from soda? Can I get it from juice and smoothies? And you know what happened? Is I literally almost wrecked the car. I was listening to talk radio because that's the really, really contrary advice. And so, okay, now going back and looking just a little bit through the workbook here, I just want to hit these so that you see it in writing what looks like. So let me just help you to just do a recap and just help you a little bit with your with what's happening here. All right. The white blood components. Remember this. This is a test question. I'm going to ask this tomorrow and give stuff away. The mnemonic for tests is never let my engine blow. Remember this, you guys. There's going to be a really cool giveaway tomorrow. I'm just prepping you of what it's going to be. Neutrophils fight bacteria. Lymphocytes fight viruses. It says white blood cells. That's wrong. It's viruses. Monocytes are garbage collectors. Eosinophils are allergies and parasites. Basophils are for allergies. So that's the mnemonic. Never let my engine blow. 60-30-830. That's one. The next one is the red blood cells are like trucks on the freeway. They take supplies from town to town, and they take the waste products to the liver and the kidneys. Too many red blood cells, traffic jams. Too little is anemia. Both of them are going to cause fatigue. So we're looking at hemoglobin hematocrit, which is basically your iron component, which I want to share with you this. Here's something that I can bring tons of value for you. That'll help you, that'll save you doctor visits and other things. The best thing that you can do for your red blood cell health, the best thing, and I think it's really good for people that have anemia and have problems with ferrous fumarate or ferrous sulfate, which is the prescription red blood cells, or excuse me, the iron, is to do something called chlorophyll. So Macy, will you help me write this as a test question tomorrow? Here's a giveaway for tomorrow. The best blood builder, natural blood filler, is refined plant blood extract. It's chlorophyll. So your fat soluble vitamins, and it is fantastic for building blood. It helps things to heal, and it really, really is effective for any blood cleanser activity. So a lot of your stomach problems, ulcerative colitis, irritable bowel syndrome, really respond to a blood cleanser. Acne responds to chlorophyll in almost all cases. Rashes, dermatitis, eczema, psoriatic arthritis, I've seen be helped with chlorophyll extract, and it really helps to with blood. Now, the other compartment of the blood tests is the complete complete metabolic panel. That's your minerals: sodium, potassium, calcium chloride. Calcium is the most abundant and most important mineral in the body. And I just want to teach you a real quick thing with calcium. Too much calcium is really bad for you. Kidney stones, bursitis is another consideration. Cataracts, osteoarthritis is aggravated by too much calcium. One frustrating thing that I have from patients a lot is when their healthcare provider says, oh, you just take calcium as a preventive for osteopenia or osteoporosis. That's not good advice unless there's a need for the calcium. And remember that calcium is activated in the bones by vitamin K2. So we got to get calcium in the stomach. Vitamin D picks it up the stomach, puts it in the bloodstream. Vitamin K2 helps it into the bloodstream. And then too little calcium is osteoporosis. Okay? Now, I was trying to teach here some calcium steps, so let me just bring that up. To get calcium in the right place so that you don't have osteoporosis or osteopenia and spontaneous pathologic fractures, we want to have a healthy stomach. That was one of the reasons why I wanted to give that giveaway for digestive. And then vitamin D picks up. Vitamin F is basically your essential fatty acids, and vitamin K2 helps to get it into that area. So if anybody's struggling with osteoporosis, I really want you to know about this protocol. Remember blood sugar: too high, diabetes; too low, the nerves fail when they drop. This is why when so many times when people go to bed at night and they can't stay asleep, it's because they run out of energy. Their blood sugar drops in the middle of the night, and then they have to get up because the body's saying, hey, you got to do something. It's trying to rescue you. Some protein at night, not carbohydrates, has a tendency to really help people sleep through the night. The total protein is important for key fatigue and stamina. And then alkaline phosphatase. This is the one thing I wanted to share with everybody. It's a multi-system enzyme that's affected by the pituitary and the adrenals. Too high shows bad things that are happening in the body, like muscle breakdown, bone breakdown. It can be a very useful cancer marker. A lot of times with people that don't have that diagnosis, what happens is it's too low and they're into adrenal exhaustion, and it's a nice way to check their response to energy therapy. I didn't have this on the sample test, but cholesterol is really important if it's too high or if it's too low. No one's talking about this. If it's too low, bad things happen. Other things that I think are really important: vitamin D3 ideally should be 80 or above. Epstein-Barr markers, we'd like to see those below 36. And total iron should be right around 100. Okay, you guys, that really does a ton of like, I've thrown a lot of information at you. Let me kind of tell you what is happening the rest of the week. Number one is tomorrow we get to go over the stuff that makes people heal, the building blocks, the things that we're going to talk. We're going to hit a gorgeous and a ton amount of information on bioflavonoids, rutin factor, quercetin, N-acetylcysteine, vitamin C, mixed tocotrienols. So that's a special type of vitamin E. We're going to talk about glutathione and how it affects different conditions, and where good sources for this. So now that we've literally, how I've tried to outline the week is to be able to give yourself a report card for, to where to put yourself. And by the way, on Friday, we have some really neat ways where I can help you with a nutritional report card. Like it's something called a system survey. It's a really neat way to identify, am I an A grade, am I a B grade, am I a C grade, am I a D grade, or am I F? Am I failing life? And then we're going to talk about how to give the body building blocks. The reason why I love that t-shirt in the office is that you're not your diagnosis, you're the hero, is because I believe in the vast majority of cases that when you give the body what it needs, it will heal. Like, it's this wonderful, amazing, complex organism that if we treat it right, it responds. And that's why we get so many patient testimonials and success outcomes. So that's what's coming up tomorrow. And then we want to share that. And then Friday, we've got some additional, like, wrapping up. Where do we go from here? What we have happening? Okay. There is a couple things that I'd like as a takeaway. One, I'm excited to give away our grand prize. I'm excited to give away additional vendor products. I've got a whole bunch more that vendors donated and said, I love this Hellness to Wellness challenge. Like, let me help you. And we're going to give away some things that really make a difference. There's a lab package. There's a year of care inside of the office. There's a whole bunch of things that is coming. Macy just posted, if you need a virtual consultation, like literally just go to that link, and we don't have to wait till the program's over. We just have to like get you healthy. And again, my commitment is to help you, whether it's me, whether it's a virtual program, or whether it's someone in your area that I can help and chime in and advise, or one of my colleagues that I've met in a seminar system. Like, I just want to get you better. My goal is to reach, teach, and heal the world by serving the patients in front of me and online. Okay, so that's what's going to happen tomorrow. Remember, there's a couple things there's this messenger concierge button that we talked about. What this is if you're registered, if you're in this messenger concierge, you get all of the notices, the updates, the emails, the leaderboard, and as the conclusion, if we wrap up things at the end of the week, this isn't over. Matter of fact, Macy and Jose were telling me, hey, now that we've kind of got the iron or the kinks worked out a little bit, we should do a stomach university. We should do an arthritis program. We should do a kidney stone thing. We should, like, there's so many things that we're going to do later. And if you're in that messenger thing, like that concierge thing, literally, it helps you to be an extension of the office and provides a wonderful information. So tomorrow night, 6 o'clock, we're going to be talking about the most important vitamins, the most important minerals, which, by the way, I'm telling you now, whoever, like, I'm going to give something away. We're going to give a sweatshirt away tomorrow, like a really cool sweatshirt. And here, like, I literally kind of going to tell you the answer right now with that is, what is the most important vitamin? What's the most important vitamin? And here's the answer. It's the one that you need. I mean, I'll almost say it's vitamin C, it's vitamin A, it's vitamin E, it's B5, it's B6, it's B12, it's folate, it's vitamin P, it's vitamin G, it's lipotrophic V. Like, it isn't. It's the one that you need. That's why it's so important to make sure that we have a good workup and blood tests, and there's a micronutrient test, and there's food allergy tests and stuff like that. And that's really what we want to do. Okay, I have all these questions coming up, and I don't know how to answer them. Like, when I click on them, what happens is I don't see anything. All right. Yeah, I'm sorry. I saw someone's hand come up, and then I clicked on it, and it went wonky on it. Okay. All right. And then Case Ellis said, maybe you need all of them, which is possible. But what I found is, with people that have chronic complex health problems, they're usually missing something. They are missing some vitamin, again, vitamin G, vitamin P, which they never talk about. There's a vitamin F that's the old school for, there's these minerals. And what happens is the body tells you got to go get it. And that's what causes grazing syndrome so much of the time. Grazing syndrome is literally when your body is grazing and looking for things, and it's looking for that mineral. So we can shut off all of those cravings if we know what you need. Okay, also a question that's coming up tomorrow, just giving people a heads up, the miracle mineral is magnesium, and here's going to be the question. How many enzymatic reactions did magnesium have? It's 300. Most important vitamins, the one you need. Okay, so I'm just excited to give away some of the vendor product that we've put together. I have enjoyed this immensely. We're going to hit this again tomorrow night, 6 o'clock, the most important vitamins and minerals and how it relates to clinical conditions. And make sure you're in the medical concierge messenger. It really helps you. It's not too late to cruise up to the leaderboard and register for the challenge, hellnesstowellness.com. If you're picking us up on Facebook or YouTube, get caught up, because there's some incredible value happening. We're actually, you have to be registered to get all of the Friday stuff, right, Macy? Yeah, okay. So, yes, we're streaming it out to everybody. We streamed out day 1, day 2, day 3. Tomorrow is going to be streamed out, and then Friday, it's only if you're registered for the people that have made the commitment to be there. I'm your host, Dr. Jason West on Hellness to Wellness. You're not your diagnosis. You can write your own story. We just want to help as much as possible. I'll see you guys tomorrow night.